Hi friends, welcome back. My name's April. Today we're going to discuss the differences in the ADN and BSN degree for nursing. And in the end, I'm going to let you know which program I selected and why it might work for you now, as opposed to if you have different career goal aspirations, why it might not be the most ideal step for you to start with your nursing career. First of all, I'd like to bring up the fact that I highly encourage people who think that a career in nursing might be what they want to do to either spend a semester or so as either a nurse's aide in some kind of acute care unit, or maybe a transporter, possibly a environmental services person. Now, all of these don't necessarily sound like they would be helpful in getting used to what a nurse might do, but if you're really good at assessing things as they go along, a skill that will be critical in nursing school and beyond, then you will be able to see what the nurses do. You'll be able to see how hard they work, the kind of actual work they do, the kind of time that's actually allotted for each different task, be they psychosocial, be they administering medications, or whatever the task may be. Another thing is, I know myself and several of my classmates going in knew that they wanted to be a NICU nurse, that they absolutely no question they wanted to be NICU nurses. And in the end, they got through nursing school and they didn't want anything to do with NICU. One of the advantages of getting into a facility and actually working with nurses is once you've done that for a while and you've shown up, you've had a good attitude, you've done all of your work on time, then you get a good reputation and you get to the point where you might be able to kind of hang out with the NICU nurses for a 15-minute break or something and see what they do to see if that really is something you want to do. Now, being able to see what nurses would do on their unit, the other advantage is you are in place in a facility, and when it's time to graduate from your nursing program, you've had a good amount of face time. A huge challenge for new grads today is actually getting into a new grad program, which are absolutely incredible. I can't even tell you. When I was a new nurse, we didn't have anything like that. You got like 2 weeks of class, and then you had your preceptorship, which was a couple weeks or whatever, and then you were on your own. So there's an incredible amount of support that's out there today, but they're limited. You want to position yourself as best you can. And I'm seeing that people having the most success with this are the people that have done this kind of work ahead of time. Plus, going into nursing school, we'll discuss some of the amounts of money involved, and it's not a cheap thing to do. So you're going to want to be sure that you want to have loans if you're going to have to go that route, or if you're going to pay as you go, that you don't feel like you've wasted money or you now have loans for a job you just don't ever want to do. Nursing is challenging enough. We don't need to have extra money that we now don't even want to have to reimburse be part of our challenge. So I want as many of you lovely folks in the profession, but I want you to be there and be happy that you're here, because it is difficult, but it is the best job that there is. I'm not going to lie. I've been a nurse for over 20 years. I've done mostly cardiac care and have worked a little bit for insurance companies, but the majority of my time, patient care has been cardiac telemetry, cardiac surgery, ICU, and cath lab. Cath lab is where my heart is. I really have enjoyed the majority of my time there. So going on into the programs themselves. So the ASN program is something that is found at your community college. It is the least expensive of all the routes, usually about $10,000 to $20,000, maybe max, is about the most expensive you're going to spend there. If you are someone who is lower income, then you might get something called a BOG waiver or a Board of Governor fee waiver. You might get different kinds of grants. And then there's always loans. I was blessed enough to only have to take out a little bit of federal loans, and I worked the majority of my prereqs and through my program. I actually did the ADN program and was an ADN for about 10 before I got a BSN upgrade. We'll talk about that later. So one of the advantages there is I was actually able to not have much debt when I came out of my first nursing program. So not having a lot of debt kind of lessened that a lot. I'm really grateful. I'm hearing about a lot of the debt nurses are coming out of school with, and I think that that would have been an extra stressor, which we just don't need. The other thing you can do at the community college, if you decide that the BSN is the route you choose to take, is definitely consider doing as many of the prerequisites as possible. You can get the prerequisite list for the nursing program from any of your state colleges. For us, it's the California State University system, and each state has their own state university system. You can get a list on their website. If you go to their nursing program, you can see what their prerequisites are. Take as many of them at the community college as possible. You'll save yourself a ton of money if you just do your prerequisites from there. It's 3 years to complete the BSN portion once you've taken your prereqs from the community college. So doing the bachelor program, if you choose just to do the bachelor program, that program can be as little as $30,000. It can be up as high as, I've seen it, about $120,000 or so, depending on if you go to public or private colleges, depending on if you do out of state. And then another huge thing being if you decide to take private student loans. Now, I haven't taken any private student loans because those have much higher interest rates, and they do tend to obviously incur interest much faster. There's also the option of working through your program as either a part-time student, as a work project, potentially at the college to reduce your fees. All of those are encouraged as long as you can continue to keep your grades up and get your clinicals done, because again, you want to come out with the smallest amount of loans possible. And sometimes that might be considering having more roommates or living off campus. That should definitely help out a lot. Now, when I went to college, I considered all of the options, even including the LPN or LVN program, depending on what part of the country you're in. I chose not to do the LPN route because specifically in California, the vast majority of the positions for LVNs are not in acute care. And I knew that I would want to do acute care in some area. In addition, I had done the math of the amount of extra time would be involved in, if I did the LPN class, I'd be able to work sooner and make a little bit more money, but it would involve an extra 3 semesters to the time it would take for me to get my RN degree. And at the end of that, the RN degree would be an ADN, or what is known as an ASN, or an Associate of Science in Nursing degree. So I knew that that was a great place to start. It was a couple of decades ago. Most facilities didn't care if you had an ASN or a BSN. It didn't really matter. And now we're getting to the point where facilities are actually wanting us to have the BSN more. That is something that we'll talk about in the next section. But I was able to do everything for the first couple of decades. I was cath lab, I was cardiac tele, I was everything. And I even worked at one of the insurance companies doing post-service claim review, all of that without a bachelor's degree. Now, those are actually requiring bachelor's degrees, as well as some of the other things, depending on where you are. So job prospects. This is the big one. This is the other area everybody wants to know about. There can be about a $10,000 a year or every couple of years less that an ADN can make as opposed to a BSN. The difference in that tends to do more with the different jobs a person can do. So one can be, there are some facilities that do require the BSN in order to work. There are some hospitals that are magnet hospitals. So in California, our university system, so University of California, Davis specifically is the one close to me, they will not accept any applicants that do not have their bachelor's degree. That is part of the way that they just want to staff their facility. They want to be able to offer the community, hey, all of our RNs have a bachelor's degree. So if you are now trying to get a position at a University of California facility, you must have a bachelor's degree as an RN. There are many positions all across the country that just don't require the BSN yet. I still highly recommend it. If I were starting over today, I would get the ASN again, or ADN, whichever part of the country you're from. Again, people call it different things. But I have transitioned to get an online Bachelor of Science in Nursing, and it doesn't make me a better nurse. I'm going to be honest with you. The reason I didn't get the bachelor's degree at first was specifically because I knew it wouldn't make me a better nurse. I'd already been a nurse's aide in the acute care setting. I'd already been a ward clerk, which is like their secretary. I'd been a monitored telemetry tech in the nursing setting. And I had seen both ADNs and BSNs work. I'd seen their practice. I'd seen very competent ADNs. I'd seen BSNs that weren't really as put together. So I knew that that wasn't the thing that would define what kind of nurse I could be. There aren't any skills that an ADN can't do that a BSN can do. In the majority of facilities, they can still give blood, they can still give IV medications. There may be individual facilities that have a couple of differences. If you know you want to work at a magnet hospital, you know you want to work at a major teaching center, like maybe the Mayo Clinic or something, or maybe one of the university system, then definitely look at their website, see what their requirements are, because you might want to kind of tailor what you look to be to match that, so that you don't have a dream and maybe cut yourself out before you already get started. I hate to see people's dreams get sidelined if they don't need to be. They just have the information ahead of time. So as an ADN, again, you can do any of the patient care stuff. The thing where you do kind of start to be held back is when you start looking at doing charge nurse as a permanent position, which we call clinical coordinators out here. Maybe you're nursing supervisor, that kind of thing. If you're going to be wanting to be a nurse manager, if you're wanting to be a clinical instructor, any of those kind of things, then you need the higher degrees. The other reason for keeping loan amounts low when you're going through this first period, the ADN, or if you choose to do the BSN first, really encourage, because there's a lot of stuff going on about loans now, is you want to save as much as you can for if you choose to go for a higher practice degree. There are lifetime limits, even if nothing changes right now. There are some lifetime limits for federal loans. And like I mentioned, the private loans can be really high. So you don't want to get stuck with that. You want to save as much of that as you can in case you think you might want to be a CRNA, the Certified Registered Nurse Anesthetist, or something like that fun. So just food for thought. As I mentioned, there are bridge programs, which are generally billed as RN to BSN programs. I've done one. I enjoyed it thoroughly. I was able to do it all online. So I was able to do it in between shifts or on 15-minute breaks. I was able to get little bits of things done. I definitely recommend that. The other reason that that worked out really well for me is I had completed all of the payback of the loans from my ASN program by the time I started that. So I didn't have any residual loans outstanding. It didn't impact my finances as much. I will go over that more in a following episode. If there's anything that anyone would like to hear about, I'm glad to review anything, any nursing topic that anyone wants to hear about. And I am pleased that you came by. So thank you very much. Have a good day. And I hope you enjoy your nursing journey. Thank you. Bye-bye.